Okay, so I think that means we've started recording. So hello and welcome everybody. This is our Moving OT's May CPD event, and we've got a bit of a treat for you today. We've got our presenter Clare McShane joining us. So Clare's an occupational therapist and CERT practitioner. She's working within a mental health team for Derbyshire, let me get this right, Derbyshire Healthcare NHS Foundation Trust. Did I get it right, Clare? Yeah, good. And Clare's going to be presenting to us today on her master's research from her time at Sheffield Hallam University. And her research was titled A Physical Activity Intervention for Learning Disabled Adults. So our plan is that Clare will present for 20 minutes to half an hour, and then we'll go into some breakout rooms afterwards and just discuss what you've heard. We'll have a few prompt questions, and then we'll come back together again afterwards. So I'm going to be quiet now and let Clare present. Thank you, Clare.
Thank you. So if someone could just shout that this is sharing.
Yes, it's all right.
Yeah, we can see
Thank you. Yeah, so as Lisa said, I'm going to talk tonight about the research that I did for my master's, which was all around a physical activity intervention for learning disabled adults. So the first slide tells you a little bit about me. I'm going to skip over that so that I can concentrate on the really important bit, which was what the participants in the research had to say. But there's a little bit in there for if you want to look at the slides afterwards about their work in mental health now, kind of where my interest in physical activity came from in my mid-30s, and also my passion as an advocate and an ally for the learning disabled community. So in terms of the research itself and why that's really important, there are around 956,000 learning disabled adults in England, and learning disabled adults live with high incidences of avoidable conditions like cardiovascular disease, type 2 diabetes, hypertension, and on average, learning disabled people die 13 to 20 years earlier than non-learning disabled people. Although the data there is around 10 years old now, there is more recent data than that, and it shows that this has not changed. So the learning disabled community die much younger than the non-learning disabled community. These health inequities experienced by the learning disabled community are a result of complex lifestyle factors, social determinants of health, including poverty and social isolation, which affect learning disabled people to a disproportionate extent. These are not things which are inherent in someone having a learning disability. They are things which are avoidable and which are capable of change. One of the lifestyle factors that really impacts learning disabled people having poorer health is that they are much less likely to be physically active. So when we look at the general population, 33% of us do not meet the Department of Health recommendations for physical activity. But when we zone in on the learning disabled community, that percentage skyrockets to 80%. So 80% of learning disabled people do not meet the Department of Health recommendations for physical activity. So there is some current literature in this area. Some of it comes from the UK, but the Netherlands is really leading in research in this area. A lot of the research that I looked at whilst writing the dissertation really came from the Netherlands. And so some themes that came out of that were there were some particular types of physical activity that are particularly popular. So of course, just like anyone else, learning disabled people will not all have the same opinion, but there were some themes that came out. So walking, games, dancing and sport were all particularly popular. Research showed that there's a correlation between physical activity and participation in the community. So this particular study showed that learning disabled people who are physically active were also much more likely to be participating in their wider community, everything from going out into the town, going to the shops, going to bars and cafes. There was a real correlation between the two. In terms of things which helped learning disabled people to want to participate in physical activity, none of this will be a surprise to occupational therapists. Choice was really important, and doing things which people enjoy and which they found fun were also really important. Feelings of pride and achievement were also identified as facilitators. And when the research looks at the barriers, organisational factors came through really, really strongly. So issues like staffing, people having access to transport to be able to get to the places that they wanted to go to, came out a lot in the research. And several studies identified the need for organisational level commitment to physical activity through things like policy change, staff management, and providing staff with appropriate training. So it wasn't that there were support staff, for example, who weren't supporting physical activity. It went much deeper than that, and it was that there needed to be real systemic change to support people to be able to do the activity that they wanted to be able to do. So I'm sure you all know this already. There's absolutely a role for occupational therapy in this. So the World Federation of Occupational Therapists and the Royal College of Occupational Therapists both advocate the role of OT in health promotion, including in the promotion of physical activity. And of course, a mention for the prevention and enablement model, which beautifully demonstrates the fundamental role of OT in a whole systems approach to promoting health through physical activity. So the research study itself, I used a mixed methods approach and working with 4 learning disabled adults, exploring their views and experiences of physical activity in a way where hopefully they had fun, and it was really interactive. So it was a small study, but when I looked at other research with learning disabled adults, that's quite common for there to be a low number of participants. Held a focus group where people could talk about their experiences and what they thought about physical activity, what they liked, what they didn't like, what the issues were. And then we had 4 physical activity workshops run across a period of 4 weeks. Participants rated their enjoyment of physical activity after each workshop. And then at the end, we had another focus group where we explored the same themes as the first one and also how people found the workshops. So the workshops that we used, the first one was a dice exercises workshop. So this was, we had a table of exercises, each given a number. You rolled 1 dice to decide which exercise you were going to do and another dice to decide how many reps we were going to do. And the exercises mimicked functional movements. So we had things like sit to stand, reaching up for things, standing on your tiptoes, so calf raises. I sort of tried to use things that would that were activities that you would see in daily living. The second workshop was a dancing workshop, by which I mean we put on music that was chosen by the participants, and we danced, we messed around, we did whatever came to us really. So it was a completely freestyle dance workshop. And then the third workshop was a games workshop. So participants were given a list of games to choose from, which was largely budget driven as to what I was able to offer. And the participants chose from that list which games they wanted to use. So we did Skittles, we did an egg and spoon race, we did a throwing and catching with the Velcro pads with the sticky ball, and we played rounders. And then the fourth workshop was a day in the life of. So that took information that I'd learnt about the participants from the focus group, and then it took elements of each of the 3 workshops and built that into a day in the life of story, which we then acted out. So that took 20-25 minutes, and we acted out what a day might look like and how we might build physical activity into the day. So the results of the research, I collected data on the attendance. So this was just whether people attended the workshops or not. So 2 of the participants attended all 4. The first participant missed the final workshop, and the fourth participant attended the first and the last workshop. So what I wasn't able to collect as part of the study were the reasons why people didn't attend. So in practice, that is something that you would know, and of course you would be exploring that and then working with people around how they might address some of those things that perhaps stop them getting to the workshops. It would have been really interesting to explore that as part of the research, because I think had I done that, I would have found that it linked in with some of the barriers that people had shared. The enjoyment data really showed that people loved physical activity. So what this shows is that the participants rated their enjoyment of physical activity as a 5 out of 5, which meant they loved physical activity. And they rated it as 5 consistently, except for the first participant, who was a 4 at the first workshop. And after the dance workshop, they went up to a 5, and then they maintained that 5. Sadly, they missed the fourth workshop, which meant they also missed the second focus group. So I wasn't able to explore with them the reasons for that, which would have really liked to have explored that with them and see why that changed. And of course, if you were working with someone individually, that's a conversation you'd be able to have. So the qualitative data is where the really interesting stuff came from. So the first theme that I pulled out of the focus groups was that there were, similar to the current research, there were particular activities that the participants really enjoyed. So walking featured quite heavily. Sports, so people talked about swimming, bocce, football. People really liked playing games, so they were games from the workshop, but also people talked about using Wii Sports at home and playing games there. And then the final sub-theme was creative expression. So people talked about dancing and drama quite a lot, and those being ways that they enjoyed engaging in physical activity. So the games workshop was the most popular for all the participants chose the games workshop as their favourite. And that seemed to be really linked with that feeding into a sense of pride and achievement. And that was really important to the participants wanting to engage and continue to engage in physical activity. So this is a quote from one of the participants whose favourite thing was the Skittles. I asked what they liked about it, and what they really loved was that they got a 10. I think they got a few 10s. And so that had really fed into them really loving that part of the workshop. And this was a quote from one of the participants who talked about dancing a lot. One of the things they really loved was learning choreographed dances at a drama group, and then showing others how to do it. And in the dance workshop, one of the songs they chose was a song that they knew a choreographed dance to, and they did that, and we all followed along with them. And I know that they really enjoyed being able to do that and being able to lead us all in how to do the dance. The second theme that came out was where people did physical activity, and the big thing that came out of this was that no one really had much enthusiasm for doing physical activity at home on their own. There was a real sense of people wanting to do physical activity out and about in the community, whether that was at club events, within day service if people went there, leisure centres and in the local area. So clubs and events, including discos and nightclubs, drama groups and walking groups, people talked about these a lot, and being able to go to clubs and events was really important for people engaging in physical activity. They talked about walking around their local town, visiting local green spaces, and sort of day-to-day things like support workers park out of town so that they could walk further to get where they wanted to go. Something which featured quite heavily was having access to a local leisure centre, and this was really important to a couple of the participants. Talked about this a lot. One of them particularly enjoyed swimming, and having access to swimming locally was fundamental for them to be able to do that activity that they really loved. So they really linked having that local leisure centre to them being able to do the activity. So they talked about, I go swimming because I've got this local leisure centre, and they wouldn't have done that if that wasn't so close to them. There was also another lovely conversation between two of the participants where one of them hadn't really fancied swimming before, but after these sessions they really wanted to start going swimming, and there was a lovely conversation between the two participants about where they lived and where their local leisure centre was and which one they could choose from. So that really did come out quite strongly how important that was. They also talked about using the leisure centre for other things, such as going to the gym and going to sessions like bocce sessions there as well. And then the final two themes were reasons to do physical activity and reasons that the participants didn't do physical activity. And the sub-themes in that, really, there was some real synergy between those. So people did physical activity because of their physical health, but their physical health was also a reason why they didn't do it at times. People did physical activity because it benefited their relationships with others, but also sometimes their relationship with others was a reason why they didn't do it. And both doing physical activity and not doing physical activity had an emotional impact as well. So when I looked at some of the health promotion literature that's out there, quite a lot of that talks about encouraging learning disabled people to do physical activity, around educating learning disabled people about why physical activity is important, educating them around the health conditions that can arise if you don't keep yourself sort of fit and well. What I found with the participants in this study is that they absolutely did not need that they understood why they should do physical activity, and they wanted to do physical activity. So they've completely recognised that physical activity was a way to keep healthy. They talked about doing physical activity makes you move about more, it makes your heart go faster. They talked about it doing them good. They talked about it being something that you could do if you were overweight or if you'd got a particular illness. And one of them talked about having to do physical activity because of my diabetes. So they were already linking it to some of these conditions that they might be more likely to live with. So the relationship with others point, the participants unanimously felt that doing activity with others was more fun. And there was this really lovely quote from one of the participants about a nightclub that they went to. So they talked a lot about being able to dance, go to a club, go to a disco, and be able to dance with others. And this participant talked about going to a learning disability nightclub. We see a lot of people there that we know. I like going to the nightclub because you can dance. I like going because we meet different people and we're safe there. And I think that last line was really important as well, that nightclub created a real safe space where people could go and do the things they wanted to do in a place where they felt safe to do it. So the emotional element, participants described feeling happy when doing physical activity. They described feeling proud and wonderful when counting their steps. And this was a conversation between two of the participants about boxing. So one of them liked to go to the gym and liked to use the punch bag at the gym, and they talked about it, about whether it did you good, and also about letting it being a way to let your anger out and go in and just taking out some of your frustrations on the punch bag and making yourself feel better. So that really showed this kind of understanding around the use of physical activity for emotional regulation, really, and a form of expression. And these are two quotes from one of the participants who was struggling with physical activity at the time. So they were having trouble with their ankle, weren't able to walk as much as they had been doing previously, and talked about how this was really affecting them being able to do the things that they wanted to do. So they talked about not being able to go walking a lot, and it was stopping them from going out, stopping them from going on the bus. And this is something they talked about a lot. That was really upsetting for them. They talked about having to get taxis everywhere, which was costing a lot of money. but it wasn't just the cost. They really wanted to walk from their house to the bus and get on the bus and go into town on the bus and walk around and do what they wanted to do in the town. They didn't just want to get in a taxi and go and do their shopping and then get in a taxi home. So they talked about, and I went out at the weekend to go and do my shopping. I had to get a taxi there and back, and I would have been using the buses, and I can't do it. And the participant got quite upset about this, and it really shows that connection between physical activity and wider occupational participation, and that it's not just about doing the physical activity, or it's not just about going into town and getting your shopping done. That there was a real connection between those two, and not being able to do that was having a really big impact on this person's life. So just as in the other research, the participants in this study found that that whether they could do the physical activity they wanted to was often affected by the availability of staff and transport. So that when we talked about the things that stopped them being able to do what they wanted to do, they talked about only being able to go to the gym or go swimming or go to the discos and walking clubs, whatever they wanted to get to. They talked about only being able to do it when we've got staff. And they talked about not getting out as much as they wanted to because we haven't got a lot of staff to take us out. On the transport, there were 2 of the participants that have been affected by funding being taken away for a minibus, and they talked about how there were lots of things that they used to do that they weren't able to do anymore because they hadn't got this minibus. And there was this really sort of powerful moment in the group where one of them just kind of said this, we want our minibus back. And it was a really sort of they really meant it. It was a really powerful moment, and you kind of really got the sense of how much that had changed their experience not having access to that anymore. So we heard about the positive emotions that doing physical activity helped with. So they talked about people being happy and feeling proud and wonderful. And I saw that elsewhere in the research as well. What the participants here also talked about that I didn't see elsewhere in the research was how they felt when they weren't able to do the physical activity they wanted to. And it really did elicit some strong emotions from all of them. So we saw with the person who couldn't get out and do what they wanted to do in the town, how upsetting that was. The other participants talked about not being able to go to the disco that they wanted to go to. So they talked about really liking going there, being able to dance and get some movement in that way to music. And they talked about how that made them feel angry when they weren't able to do that. Another participant said when they wanted to go to the gym in particular or go to a particular club that they weren't able to go to, they said, I want to hit something. And another participant talked about it being frustrating. That was in relation to they like to go swimming a lot, and if they weren't able to go swimming, they found that really frustrating. So that was really striking how strong those emotions were when people weren't able to do the things that they wanted to do. So the main points I think that came out of the research were that particular activities seemed to be popular, and this matched up with the other literature that I found as well. So walking, dancing, games and sport were particularly popular with the participants that I worked with. That all of them connected physical activity with community participation and connection with others in some way. They all much preferred doing physical activity with others. They all like to get out somewhere to do their physical activity. That choice was important, that they wanted to be able to do what they wanted to do when they wanted to do it. And that quite often the reason they weren't doing that was because of organisational barriers. That there wasn't staffing, that there wasn't transport, or the transport was expensive, or that sessions were cancelled, or things that used to happen prior to COVID, for example. They talked a lot about that things used to happen, and then in the last few years they weren't happening anymore. So there were things that they were missing out on because of that. And then also this emotional aspect, so positive emotions associated with physical activity, but also the negative emotional impact of not being able to do what you want to do when you want to do it. So the role for OT, I think physical activity is absolutely meaningful activity. It's so much more than just moving around. It's really fundamental to our belonging, to community participation. And so it is absolutely the job of OT. It would be lovely if we could have a greater focus on physical activity interventions, and based on what these participants talked about, particularly those which promote and support community participation. There's always a role for us in promoting the human right to occupational participation, including the human right to participate in physical activity and all the things that gives. And then I think claiming a place at the table for occupational therapy and for the learning disabled community in discussion about health promotion through physical activity. So there's already lots of good stuff going on in this area, but there's never enough. And there's never enough learning disabled voices directly in these conversations. And I think as OTs, we can really advocate for that and advocate for the voices of the people who are actually affected. And so if anyone's got any questions, I'm happy to take them, or I think we're going to go into some breakout rooms to talk about it.
Thank you, Claire. That was a fantastic presentation. I've definitely got questions, but I just wanted to say, kind of on behalf of everybody, that was great. And I think you brought up so many important points within that around occupational justice, about there being, you know, a public health need here that OTs can support. And yeah, I mean, I'll let other people, if they have questions, ask their questions first, because I've got lots that I could ask. So I think, did I see a hand go up? Is it Michelle? Can't see everybody. It's decided
that was
to.
Definitely a thumbs up.
Yeah.
But no, I just wanted to say thank you. I think you really, like, you summarised so much of a lot of our participants' experiences really well. Yeah, so I recognised quite a lot in what your participants expressed. But yeah, thank you. It was great presentation.
Oh, thank you.
Sorry, Michelle, I'll put you on the spot there.
Okay.
I have a quick question, and I know it's a great project, and I just wonder, were there challenges? Because as OTs, you know, we like to do creative things, we like to do things differently, and I wondered, were there any challenges, and how did you overcome them?
Yeah, so I think one of the challenges was that I was doing this as a student and it was research and I couldn't just do what I wanted. So I probably wasn't as OT in the sessions as I would be if I was running the sessions now, because I kind of just had to let them happen in a safe way and see what happened. So I think there was much more. One of the challenges was kind of wanting to give people lots of encouragement and maybe wanting to give people more sort of individual help, and I had to sort of moderate how much of that I did because it was research. But yeah, there's definitely, I think people could have got a lot, could have got more out of some of the sessions if there'd been people there who could have helped them to engage in a different way. There were a couple of challenges just around the practicalities which we were able to sort of address. So one was the rounders that they chose, and I'd sort of predicted this, that it wasn't, rounders bats are horrible for anyone to use, and so we took the paddle that we used for the Velcro but with a rounders ball, and then used that, so you were essentially hitting it with a bigger version of your hand, and then the rounders was brilliant and they were smashing it out of the park every time. And we also had one of our participants used a four-wheeled walker, which made the egg and spoon race challenging, but there is nothing you can't fix with some sellotape, so we taped the spoon to the front of the four-wheeled walker, and yeah, they were flying up and down the gym. So
that's amazing.
Yeah, that was fab.
I'm just good. That's a perfect image. That's such an OT thing, isn't it? Like we've adapted it. Yes.
Yeah.
Liz, did you have a question as well?
Hi Claire, thanks for that presentation. It was great, and I've got a few questions. You can answer one or both. The first one is about language. Is it politically correct now to say learning disabled rather than learning disabilities? Or because I get a bit confused with that, so it would be good to have your advice on that. And I guess my second question is just your stats that you gave around the 33% for the general population and then 80% for learning disabled people, which is like shocking. Well, I mean, it's not that shocking, but it's just terrible, and really kind of highlights the importance really about OTs and other healthcare professionals, but OTs getting involved in this. Have you? I like that I'm hearing you say to others we should be getting involved as OTs, and I like the fact that you're kind of highlighting that the RCOT and World Federation of OT also support that, because I think sometimes it feels like me, Lisa, Sam, and Sport for Confidence are the only people saying it. So it's nice to hear it from you. I guess, like, what's your thoughts or advice on OTs kind of pushing this further and actually telling our managers, going back to our clinical spaces and saying we've got to do something about this, and actually we can do something about this? And so any thoughts around any of that would be interesting.
Okay, so the first question, I think, in terms of, is it learning disabled or is it person with learning disability, I think it's up to them. So, and there's always debate around these things, isn't there? And whether it's person first or you know, do we really need to point out that they're a person? Because of course they're a person. So which is sort of the debate around person first language generally. So so I tend to go with learning disabled person, but sometimes I will also use people with learning disabilities, and I think it's up to the people in the community really. I'm not sure. Maybe others will have other thoughts, but there's that neither is right or wrong, I think.
That's even just you saying that is helpful to know, because I hear myself sometimes saying learning disabilities and thinking, oh, should I be saying something else? It's hard to keep up with what is right. And
in terms of the second question, I'm actually really interested in what everyone else thinks about that, because I think I have to be really honest about my position, that I am a real advocate and ally, I hope, for learning disabled people through volunteer work that I have been doing for the last sort of 7 years, and through this research and this research project. But I am a newly qualified OT, so I've got a different background in another career, and so it's I would love to say we should all go and have conversations with managers and, you know, everyone, policymakers, you know, take me to Downing Street and have a conversation. You know, I'd love to have a conversation with everyone about it, but actually I'm a newly qualified OT, and, you know, I want to have conversations with people that know better than me, I guess. So just be really honest about my position on that. I don't know if that's a bit of a cop-out, but it's an honest answer. So
no, I love that you're so passionate about it, and I think it is hard. It is sometimes hard to have those conversations if you don't feel confident about it. So how can we support people to feel more confident about that is a really good question. And maybe that's something we can address in one of our coming community of practice sessions. You know, what do people need to feel more confident about that, if that's a bit of a barrier? So I think that is a really good question, and maybe that's something we can think about for future sessions. I can see Georgina's got her hand up, and there's a couple of questions in the chat. So Georgina, do you want to go first?
Hi. Just, I don't know if it's a question as much as an observation. I work in a college for people with learning disabilities, and so I'm my thoughts, my aims are very much aligned with everything that you've spoken about this evening, Claire. We have some positive initiatives happening in college along these right lines. But what I notice is we have learners coming to us from quite a wide geographic area, and we can try and embed really positive habits and thoughts, feelings around exercise, and broadening perhaps what people's opinions are about what exercise means whilst they're with us. But what I find is that when learners leave us, there aren't the people in their local communities to continue and enable the activities that they might have found that they really enjoy. So that's I guess an observation, but also perhaps a question of, I don't know if you have found, whether it's a team or a particular person or job title or whatever, of who might be. So every community seems to be so vastly different that from a college point of view, it's really tricky to find somebody to try and link each learner with, given that their social situations are also vastly different. So yeah, that's, I don't know, have you found a person, a job role, whatever, that does that link? Because I agree that occupational therapists should be within that conversation. But I feel like we should be everywhere.
Yeah.
So there's not enough of us in all the places.
Yeah, I completely agree. There aren't enough of us, and we should be everywhere. And it's and I think I would say what I've seen is exactly what you've said, is that it's really reliant on the area, on what's going on in the area, on what community groups have been set up. So I know in Derbyshire there are particular link workers within the local authority that I hear from people that work in services that are really good at linking people up with things that are going on in community, but it's very county based, so I think it is really difficult. And I think I guess this is happening nationally, but also in Derbyshire at the moment they're consulting on the day services, what's going to happen with the day services, and inevitably some of them will close, with the idea that people will access what they need within the community, as if that is just going to magically happen, and as if it exists, that this stuff's all sitting out there waiting to replace day services, and I'm not convinced that it is. And where the funding for that comes from, because it won't come from the funding that is currently funding the day services, I imagine. So or not entirely. So it's a massive challenge. I guess what I'm asking for is something that's really hard to deliver, but I think you gotta shout about it to try and make it happen, I suppose. But yeah,
I feel like there's a real role for occupational therapists there, you know, that isn't being picked up probably by anybody else in the community. Yeah, maybe social prescribing does a little bit of that, you know, in terms of connecting things, but I honestly feel like, you know, the work that Sport for Confidence is doing could be, to some extent, for each community, be replicated on some level to offer those opportunities. And occupational therapists have got such a big role in that.
So, we have a particularly unique view, don't we? I think we have that, you know, that occupational justice sort of view that I'm not saying only occupational therapists can have that view, but we do look at the world in a certain way, I think.
I'm aware of time, so what I'm going to do, I know we have a few more hands up, but I might get people to put their hands back up again once we've come back from the breakout rooms. Liz, can we do the breakout room magic? And I'll post in the chat. So we've got a few little prompt questions, and we'll maybe go in just for 5 or 10 minutes, have a bit of a chat, and you can use these questions just to kind of prompt your thinking around that. So would you use a similar intervention to what Claire has presented? And you can find in the chat, I've posted the link to a Google Doc that has more information on the intervention itself as well. Thank you, Claire, for sharing that with us. How would you use that? Are there any challenges that you could foresee, and how might you overcome those challenges? So I'm hoping that you'll have access to the meeting chat still when you're in your breakout rooms, and you can use those as a bit of a prompt. So just thinking about those and thinking about your answers to those.
I'm muted. Are we going to say 10 minutes?
Should we go for 5, and then that gives us a bit more time to come back and discuss? So just a quick discussion.
Okay.
Because I know people had other questions as well, so we can maybe get those answered. The breakout room magic is happening.
Yeah, so I think Claire has automatically gone in then. I assumed she might be with us.
Yeah, because she was one of the
Why
organisers.
has Rhea not gone in then? Are you?
I don't
Hi,
know.
Rhea.
Hi, Rhea.
Hi guys, no idea why I'm not gone in. I'm just the odd one out, possibly.
Aw.
Nice to see you all.
Yeah,
it
good to
is.
see you.
Lovely
Good to see you again, Rhea.
I'll just see if I can add you, Rhea. Oh no, it says unassigned, and you are like you're not
Am I an
involved.
anomaly?
Yeah, you are.
You're stuck in a
I like
vortex
it.
or
That's a good
something.
way.
I was struggling getting in anyway, so I just quickly put because I'm on my phone, so I quickly put like Teams on that. So I don't know how I got in, but anyway, it's good that I'm in.
Yes.
Well, we could just have
So
our
I
own
wanna-
little group here.
Well, I
have
want
our
to
own
keep
little
up
group.
with
There you
you
go.
guys because hopefully in the future, it's something I'm quite passionate about. The physical activity of getting people from all different diverse communities actually doing, because with the day centre thing, money and closing and things like that, it's going to cause a massive impact on people, especially living with learning difficulties and learning disabilities. And I think we
are
all
only going to get worse, aren't they? I mean, looking at the stats that Claire, presented to us, they're bad as they are. If we close the opportunities down to be active, it's scary, isn't it?
I mean, you see it with so many services all over, don't you?
Yeah.
That's the
Is that?
I think
I'm guessing that's happening in Derbyshire. It's happening elsewhere, is it, Claire?
Yeah, definitely in Sheffield.
Yeah.
What-
And I
what
think
they-
I first
what they
heard
hoping
about
to
it in
achieve?
Nottinghamshire. So
Yeah.
I think,
Same.
yeah, I think the official rationale is that it will promote wider community participation rather than kind of confining people to a day service. But
Which is fair enough.
is absolutely valid and
Yes.
is brilliant. Yeah, great.
Yeah.
The more integrated we all are, the better. If we really are all integrated and if it's properly supported, because it's just not that easy.
No, they're kind of going for that care in the community thing that happened in the 90s and shutting down, which they should have shut those institutions down.
Absolutely.
But this is, I feel like, quite different because people are wanting to go to a day centre to be, that sense, like you said, that sense of belonging. There's opportunities there for them to do things with friends.
And if people are already, learning disabled people are already more likely to live in poverty, are already more likely to be socially isolated. So closing day services doesn't give them more money to be able to do the things. And when you look at, it's just one quote, but the person who was talking about the nightclub, and one of the things they said, totally unprompted, didn't, you know, completely came from them, was that we're safe there. And so going to places where people feel safe is also really important. So whilst integration is important, integration can be really scary, you know, to go
and
to
requires
somewhere.
a lot of support to be able to do that people probably aren't going to have the access to, because that funding isn't going to be used for that probably. And the world is not always very nice, and people aren't always kind to people with learning disabilities. That people can be really quite horrible, and so, you know, just expecting people to go out there into the big wide world and find things to do and have a lovely time, it's just not realistic without lots of investment and support, which would be amazing if that was there and people could go out and be a part of wider society safely. And
really baffles me, Claire, is like how in an ideal world, in an ideal situation, because, you know, finance are changing for people with the way that the government's paying PIP and DLA and things like that. You know, I keep up to date with things like that. But what about these day centres that are closing? In an ideal world in the community, it's the environment that affects the people, the accessibility to people that have maybe cerebral palsy, use a wheelchair. You know, when I think of my local swimming centre, that wouldn't facilitate somebody using a wheelchair. You know, it's an old one. It is what it is, but it definitely won't do it. So this is what always baffles me. Yep, let's get everybody into their wider communities to integrate everything, but it's never going to work if the environment don't fit either.
Yeah. I think there's so many things going on there, isn't there? And then, I mean, we've had a recent experience where, you know, it's systemic as well, that as you mentioned, Claire, where you know, you can have strategies all you want, but you need different components to actually show willing. Otherwise, you're going to come to stumbling blocks. And but also this sort of sense of just talking about the sort of sense of belonging as well is just something that you know, was PEM report has come through, you know, numerous students that we've supported as well, RIA including, a sort of sense of, you know, people feeling that sense of belonging, and that can be, you know, it can be people within a group where people have a learning disability as well, or it can be in a wider community group where it's you talk for hours, couldn't you, about it?
I could talk for years, I think.
1 minute warning.
Come back in again. Do they automatically come back? I don't know how the magic happens.
I've got to, well, I'm doing it. So I've got to close rooms. So I've just given them a 1 minute warning. So I'll get them back in a sec. And then I think it gives them another 30 seconds or so.
Were there a couple of questions in the chat? Claire, that we didn't get around to. There's one from Emma. And Ria, I think you had
Ria as well,
Yeah.
Okay, I'm gonna get. I know it's not quite a minute, but I can't wait any longer.
Yeah. Interested to know if they had the questions and they could see. Hello, everybody. You've made it back. Yes.
Hi. We're back.
We'll just wait till everybody arrives back again. Hopefully nobody gets lost in the ether and has to rejoin. Excellent. So were there any things that people wanted to feed back from their groups? Did you have access to those questions is my first question. Could you see them? You could. No. Some people are saying yes, some people are saying no. Oh, no. So I don't know. Anna Maria, do you want to go first?
Yeah, we discussed about it, that we would apply this to different category of health condition. but we discussed about the challenges that might come, like medication side effects, and weather. When did you do the study actually? Because we discussed about winter when it's raining, cold. So this is quite a big challenge for everyone, not just for people with learning disability, but also for elder people with other conditions. So that is quite big challenge for everyone.
Yeah. So in terms of time of year, it was in March, so it was wintry, but it was with the intervention was with people who were attending a day service, so it was within a day service setting, because as a student doing research, there was quite a big ethical process that I had to get through to be able to do the research at all, and so some of what I did was kind of limited by the parameters of being able to get it through the ethical process. So I didn't get the same challenges that you would get in practice, and that is a sort of limitation of the study, really, because I had quite a protected environment of people at a day service, and they were brought there by the transport that got them to the day service. So yeah, it was maybe a bit of a luxury version in some ways of what you might be faced with in daily practice.
Yeah, because many people don't really have transport, so it's quite difficult to come whenever they want.
Yeah.
It is, isn't it? It is a bit of a challenge. We've found, I suppose, from one of our students recently that in short notice, having the challenge of organising a group, and it was linking in with those community organisations where people were already accessing, that meant she was able to do that. So those are people who are to some extent already accessing the community. So it's great because they're becoming more active, and some of those participants had multiple disabilities, some had learning disabilities, physical disabilities. So it was really serving quite a broad range of people, but they were people who were already accessing a service. So there is that aspect of, maybe it's great to reach out to groups that already exist to be able to get that participation, but are we then serving people who are already being served to some extent? It's tricky, isn't it?
Yeah.
Ali, did you have your hand up?
Yes, I have my hand up twice. I don't know. Do I talk about our group first?
Yeah, go for it. Yeah.
Because sorry, we didn't have the questions, but we had a wonderful conversation about the importance of dance. And I just relayed the story of my parents were brought up in the Midlands. So my mother was from Coventry, my father was from Birmingham. And at that time, and I guess this would be in the 50s, my mum used to go to work, and at a lunch break, they would have a dance hall open, and everybody used to take their sandwiches and their flask of tea and go for a dance for an hour at their break time and then go back to work. And we're just thinking about how wonderful would it be to have access to that, where a dance hall as such would be open for you to go and move and jive or whatever you wanted to do, and then just go back to work. I just think there's a business there somewhere.
It's built into their day. That's amazing.
I just want to comment on that quickly. Like, I'm up for that. I keep on thinking, shall I create it, or will someone create it? So I think that is a good idea.
Okay, Liz, I'm in.
Are you in? Yeah, let's all create it.
Here's the business.
But I also just wanted to share, I was at a conference last year, and I went to a workshop, and it was hosted by a group called Dance Syndrome. And at first I wasn't keen on the name, but then it was co-produced and it was owned by the group. So I was like, perfect, that's great. And it was slightly embarrassing, right? Because they showed a fantastic video. It's really worth just looking at their website, and the work that they've done is incredible. And it was so emotional that I cried. And then I realised my colleagues were in the room, my boss was in the room, and there I was crying my eyes out because I was so moved by it. But it's just worth looking up, because it's a start. I think it's a charity that's started by somebody that is learning disabled and has been supported to create and develop it, and it's just fantastic, all about dance.
Amazing. We need to find that. I haven't got a link to that to post in the chat, but one thing that I was going to remind people as well, so Claire shared her intervention plans with us very kindly, so there is a link to that in the chat. And if you want more full details on the intervention plan, Claire has kind of kindly said as well, you can contact her and reach out to her just to get more information if that is something that you would like more information on. So thank you, Claire. We really appreciate you offering that.
So there is a version that has more of the sort of modifications and more about what we did than the version that's been shared at the minute. So yeah, if I just put my
if you want to put your details in the chat, that would be fab. Oh yeah, excellent. Thank you, Claire. Lovely. Does anybody else have any final thoughts or questions that they want to share? I mean, I could chat to Claire all night about this, and I'm sure we probably all could, but I want to be respectful of people's time and let you have some time off.
I think there was a few more questions in the chat, Lisa, I think.
Oh, yes.
And Claire, we didn't catch the end of that because you were on mute.
I was, and I realised that's the second time I've done that this week. I've never done it before, and that's twice this week. So all I said was that there's a version of the interventions that's got more detail in it about the modifications and more about what we did. So if you wanted more information about that, then I can share that. And then I said that I was sharing my email and my Twitter, but you can see that already.
Nicola, sorry, I know you had your hand up before we went into the breakout room, so please let us know what your question is. Sorry, we cut you off last time.
Don't worry, I'm slightly going to embarrass Claire a little bit. No, I just wanted to say, like, it was just incredible. And so yeah, I obviously trained with Claire, and so knew obviously part of what her project was, and it's really lovely and inspiring to see, obviously as newly qualified as well, to kind of be where you are now with all these other people. And yeah, it's just been really lovely and influential. And I think even though it's the things that we all probably kind of think about, I think it's really important to have these sort of like talks and discussions and think, oh, okay, yeah, like that's just given me another boost to go and see what else I can do. So yeah, I'm just really proud of you, and thank you to everyone else. It's been lovely to meet everyone.
Oh, thank you, Nicola. That's why we run these sessions, so that we can, share good practice that's going on and connect people up. Like you say, it's that little boost, isn't it? It's hearing about different stories, different ways of doing things, thinking about how can I think about my own practice and maybe integrate something different or feel a bit more confident because I've seen someone else try this. So yeah, thank you for sharing that. And yeah, it's been a fantastic presentation. Thank you, Claire. I'm just mindful there were a couple of other questions further up the chat that I'm just trying to scroll back to. I think Emma had a question around how did we evaluate outcomes of the physical activities? Don't know whether you want to just speak a bit to that.
So the really short answer is that we didn't, beyond the focus group. I think, again, it's that thing of the research is the research, and you can only answer the questions that you're approved within the research proposal. So whilst there would be so much more that you could do if you as running this, but I was sort of there were so many things that I wanted to evaluate, but I had ideas beyond my capabilities as a master's student. So yeah, you're sort of limited to what you can test within the time that you have as a student. But yeah, ideas about how to evaluate outcomes would be great. And I think the same with Ria's question about clinical reasoning. I kind of based the activities that the workshop designs were based around just trying to explore different ways that people could engage in physical activity and trying out a range of things. But beyond that, I couldn't change them as we went through. So even though they weren't necessarily perfect, I couldn't change them because they were they were the workshop designs that have been improved as part of the research process. So I wasn't able to change them sort of midway. So it's very different doing it as a research study than doing it kind of for real. So
it's hard as an OT not to be able to adapt things, isn't it? They've
Yeah.
basically tied your hands a bit there and
Yeah,
said, no, you have to
yeah.
stick to this plan.
Yeah,
I can see that being
but
quite
then you
frustrating.
learn, I guess, the other way is that you learn that actually I did that, but that would have been better, and it's
Absolutely. Make those recommendations.
It's as valid to test it and think I could have done it differently than
Ali, you have your hand up.
Yeah, I was just going to quickly say that in the setting that I've been working in, people were quite, that was a mental health setting, people were quite threatened by the term physical activity. And so I had to even adapt that.
Yeah.
Say, right, how can we increase movement?
Yeah.
How can we move a bit more? Because
Yeah.
that was non-threatening. And then then everybody understood that, you know, we could move a bit more.
Yeah.
But the physical activity, even from staff, non-OT staff, was seen as quite threatening.
Yeah, that's really interesting, because I went with physical activity because exercise had a similar effect.
Yeah.
That
and then
if you
that's that downsizing.
Yeah.
What is achievable and what is non-threatening.
Yeah, when I talked about exercise, it got a very different response. Kind of, oh no, I don't like exercise. But they talked about that in the focus group. Oh, I don't like exercise, but physical activity is good. Just that.
Yeah.
Yeah.
Thank you.
And I guess we all have that, don't we? We all have, oh, I don't like exercise, but I do like going for a walk, or it's,
What doesn't feel like a chore? What terminology works for people?
Yeah, what language works for us? Yeah, absolutely.
Well, thank you everybody for joining today. It's been a fantastic discussion. Claire, your presentation was amazing and prompted us to really think, I think, around, you know, how we can potentially integrate some of those things into our practice. There are, and I'll email around the intervention plans again. Please do reach out to Claire if you'd like those kind of more detailed, adapted versions. So thank you everybody for being here. We've really enjoyed seeing you all and hearing all your thoughts. So thank you.
Thank you. Bye.
Thank you.
Thanks, guys.
all.
See you. Thanks, Claire. Bye, everyone. Bye.
Bye.